from Austin. I know you have a really important surgery, such as cataract surgery. What are some of the real salient points that you'll be addressing in that topic?
So one of the things I'm evaluation, and then I'll have.
So that way it gives the patient some time to digest the information that you've provided and to bring in a list of questions that they may have. Overall informed consent process that you've come across over the years. Obviously, it's not a one-size-fits-all kind of scenario, and it's not a one-size-fits-all kind of surgery. So what are some areas where...
Knowing all of the things the patient with too much information, that degree of time, then I could convey what I needed to the patient without overwhelming them. So as much as it's painful to have to practice this kind of thing, it's more fun to practice surgery, but this is also important to address.
Yeah, that's a really good point, Naveen, because of course, so having condense it, how do you decide what's important and what's not as important? Because obviously you can't say...
What I'll say is something like this. 30 to 40% of patients will get a clouding of the sac holding the lens. There's also less significant risks, but more common things like dry eyes, floaters, droopy lid, and some shadows on the edge of the lens that some patients will see. And so that's basically my spiel and information I need to.
Mm-hmm. Yeah, Naveen, that's a good point. And one thing that I've found over the years is that certainly not all patients want to be consented in the same way, meaning that some people want to know absolutely nothing about it. They just want you to do it and get it done. Every nuance about every detail that could possibly be known to all of humanity. So
I find that there's actually two groups of that patients usually mention the risk of get a little people that want to know too much, don't have access to, or I'm not aware of, and that just gives them an evaluation. Doesn't mean you're obligated to take them on as a patient. So sometimes it's an opportunity to
refer to for another opinion, even if that opinion confirms their opinion. Approach anecdotal evidence that patients bring into the 20, and I really don't want to get, and she had to have a cornea transplant, and her broke her that.
It's serious wide. Look at your macular OCT target. I am careful to tell them, we're going to check your distance vision the next day, but don't expect to see clearly. We're also going to check you at near, and that's based on prior experiences with other patients.
Expectations are perhaps too low, and the patient is reluctant to undergo the process entirely because they've had an anecdotal evidence of a...
Some patients who will have vision, more common things, floaters, dry eye symptoms, ptosis, and those kind of things. That I'll kind of refocus their attention on the things that are more common, although less serious.
Yeah. Well, Naveen, about elective surgery like cataract surgery, thank you so much for sharing.